Welcome, welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As everybody knows that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can definitely WhatsApp on 9226810 My dear friends, you can understand that you knowing well because you have seen so many 15, 20 plus videos on this series. That series is regarding the family doctor, family physician, and of course for the general knowledge of the patient. We are discussing when the patient comes with the different complaints, then how the your family physician, medical general practitioner can think about your problem, what can be the different causes, differential diagnosis, how the investigations can be done, and how general management can be done. So today we have the case or the patient, 48-year-old male patient, 48-year-old male patient, and he arrives and says, Doctor, see, I am having a pain over here, doctor, right shoulder, and also here on the neck region. I don't understand what is that problem because I don't have any sprain and all this thing, but I am getting a bad pain on the right shoulder and the neck. Even the pain goes up to here, doctor, arm and the forearm. Here also I'm getting pain from this side. Okay. So whenever the patient is complaining of the shoulder or the neck pain, the doctor is thinking and start thinking about two important possibilities. One disease, differential diagnosis is whether this is cervical spondylitis or whether it is shoulder periarthritis. Shoulder periarthritis is commonly known as frozen shoulder. Two possibilities. One is cervical spondylosis, case is different, and frozen shoulder is the different case. Okay. Now, what the doctor can clinically specify that particular two types of the dilemma. This is a confusion, na? Cervical spondylosis or frozen shoulder. Simple answer. Giving you a simple answer. What doctor can do? Just gently lift this arm. Gently lift the arm at the shoulder above the head. If this movement is painful, then it can be the frozen shoulder or shoulder periarthritis. If this movement is painless, there is no pain while lifting the hand, then that is cervical spondylitis. Simple thing, simple clinical test for the diagnosis. Lift the hand gently of the patient up above the head. If this movement is painful, then that is frozen shoulder. If it is not painful, then that is cervical spondylosis. Okay. Now, sir, tell me whether you are getting any tingling numbness in the fingers. No, no, doctor, I don't have any type of this sensation. Okay. But tell me, you have already explained, but tell me whether the pain radiate up to the fingers. Pain is radiating. Yes, yes, that is true, doctor. I am also having some uneasiness over here and pain also. Okay, okay. Can you also tell me whether you get a little bit giddiness? Giddiness when you look upwards. Yes, doctor. Sometimes I get this type of the giddiness. So two or three things are there. Pain is radiating towards the fingers, giddiness while looking up. These two things are going towards the cervical spondylosis diagnosis. Okay, doctor will move further. Doctor will try to palpate the cervical spine here. Cervical spine and paravertebral muscles here. Paravertebral muscles here. Doctor will try to palpate up to the trapezius for the tenderness. Okay. Then doctor will do testing for the pain during the neck movements. For example, the doctor will ask, bend your head down. Okay. Flexion. Then go back. Extension. Then turn on the right side. Then slowly turn on the left side. Whether you are getting pain over here, then turn like this. Pain on the extension like this, and lateral flexion, confirm the diagnosis clinically in the clinic. This diagnosis, provisional diagnosis, is confirmed that this is the case of cervical spondylosis because he is getting the pain during the neck movement. Now next, the doctor will compare both the palm. Can you see here palm? Both the palms for the wasting of thinner eminence and hypothinner eminence. Can you see? This is called as a thinner eminence and this is hypothinner eminence for the wasting. If the patient is, now this patient is senior citizen, but if the patient is young, then doctor can test for cervical rib. Please check the cervical rib. It can be confirmed by the X-ray or thoracic outlet syndrome. Thoracic outlet syndrome is another thing that we will discuss at some another time. But if the patient is young, then these two things should be kept in mind. Then that is for that you can do the Addison's test. That will also I discuss some another time. Addison's test, but note this point. Now next, if the pain is radiating on the left arm, okay. Now this patient is complaining pain on the right side. But if sometimes some patient complaining pain radiating on the left arm, don't forget, especially if this pain, heaviness is increasing while walking or climbing upstairs after exertion, then be cautious. There may be, you have to rule out the another heart problem, that is angina pectoris. Radiating, pain radiating on the left side, that is I am telling you, not on the right side. Okay. Now, the diagnosis is clear. This is the case of cervical spondylosis. The doctor has to prescribe NSAIDs, non-steroidal anti-inflammatory drugs like Combiflam, Voveron, Meftal-Spas, etc. But before prescribing analgesic anti-inflammatory medicine, the doctor should confirm that the patient should not have the epigastric burning, acidity, sour erections. Then only he can prescribe NSAIDs. Always give the NSAIDs after food. If the patient is asthmatic, known case, don't prescribe NSAIDs or be cautious. If the patient is having hypertension, don't give any steroid like Visolon, because steroid, Visolon, prednisolone will increase the blood pressure. It will start the problem of ulcer. So don't give steroid in the hypertension patient and ulcer patient. Okay. Now what doctor can do? The simple, either oral or injectable Voveron injection intramuscular in the gluteal region. Then locally Voveron gel can be given after pain is over. No pain, no tingling sensation. The patient is okay. Then ask the patient about his proper posture while sitting, while standing, while walking, and also regularly he should do the neck muscle exercises and also physiotherapy. Okay, and in Ayurveda it can be given like Snehan and Svedana, oil massage and fomentation. Now, if the pain is very, very severe when the patient comes to you, simultaneously after giving this NSAIDs, etc., the doctor should ask for X-ray of cervical spine, AP and lateral views. Two X-rays are taken, antero-posterior and lateral. Then, if necessary, cervical traction of 5 to 7 kg for 20 minutes, 2 times in a day for 5 days can be beneficial. I repeat, cervical traction, approximately, everything is approximately, weight should be adjusted according to the patient's response. 5 to 7 kg for 20 minutes cervical traction, 2 times in a day for 5 days can be give, this particular nerve compression will be released. And otherwise also, if the patient is having hectic lifestyle, always has to move on the that motorcycles, etc., patient should wear the cervical collar for some days, not always, but for some days, to give the rest to the cervical bones, joints and the muscles. Okay, so my dear friend, this was a small discussion about the cervical spondylosis and differentiation. Frozen shoulder, just a few remarks about frozen shoulder. Frozen shoulder is a chronic type of the disease, and especially it has 3 phases. In the first phase, the patient will start pain in the right or the left shoulder. Then gradually the stiffness will increase, and at last pain will totally gone and only stiffness will be there. So there are 3 phases in the frozen shoulder. It can be of 15 days, it can be one phase for 1 month, second phase second month, etc. Even the first phase can be extended to the 2 months. So frozen shoulder is a chronic type of the disease. So my dear friend, this is all for today, and we will continue such type of the clinical discussion in our further videos. Okay. I request all of you to like this video, share this video, and don't forget to subscribe my YouTube channel to boost my energy. Thank you very much. Take care and see you in the next video. Thank you.